All right, guys, we're here at Rebel Mobility and Fitness today with Dr. Frank. If you'll remember, a few weeks ago, we had him on the podcast. I am a patient of Dr. Frank's. I come see him once a month, and today is just my monthly visit where we kind of talk about what's going on. He'll work me up on whatever problems that I feel like I've been having here in the recent past, so we'll go through that stuff. Hopefully get it all fixed up. He'll send me some homework. Hopefully you guys can learn something today, see how Frank works. Obviously, if you want to get a hold of him, his business is Rebel Mobility and Fitness, located in Clear Lake, Webster area on the south side of Houston.
Let's follow up from last time I saw you.
Yep.
Okay. Right now, how's shoulder?
Shoulder, 10 being the best, or 10?
10 is the worst pain you've ever felt.
Okay. I'd say like a 3.
3.
Yeah.
All right. What about hammy?
Hamstring's like a 1. Like as in like I feel it, but feels pretty good. And honestly, like following up from last time, kind of what we talked about, the timing thing.
Yeah.
I really think that you kind of nailed it. Like it was more of like a timing.
When we were talking about programming.
Like the time kind of thing. So my hamstring feels really good, to be honest. I have noticed that the big toe thing, it could be though that just because like I started doing lunges again.
Okay.
Right, where I avoided that for a while. And so like that pressure on the back foot kind of thing on that toe.
Well, here's another thing to think about though with it is the functional activities, the decreased running, so the decreased toe off or push off, right? Because you're starting to taper off of that. I'm 100% though, if you're using the inserts in your shoes,
just started back on them.
Then like you're gonna start shifting around again too, trying to find your balance spot, and so you'll probably see like less stress over time.
Okay.
Percent of your day where you notice your shoulder?
Most of the day, but I would say most of the day it's like a 1 or a 2.
Okay.
I'd say around exercise is where I feel that like
push press.
Yeah, especially pushing exercises.
So 25% maybe.
Yeah.
Like if you're demoing or something. Okay.
Nothing has felt better, to be honest, than that after that first day of using the thing.
Yeah.
That felt good, and then I think I told you I like was feeling good, so maybe I pushed it a little too hard.
Yeah, you were. It was the lateral raises.
Yes, that's right.
Okay. Did you go around and change your programming like we talked about?
Yeah, I just kind of backed off on the intensity, higher reps, less weight kind of thing.
Okay.
No, I think at the moment I'm just going to kind of groove back into running, and I'm not going to actually race again until it's winter.
Okay.
Yeah,
so then technically you're starting to get into off season.
Yeah.
Yeah. So then this is where like now you have the luxury of time building up your base from the neuromuscular motor control stuff into the endurance stuff into hypertrophy. So it's basically your long game.
Yes.
Yeah. All right. Cool. Let's table test and see how you did. Yeah. I see you grimacing. But
Yeah, I mean, it's just because I'm worried about it. It's like mental.
You're guarded about
it.
It's testing solid though. Push up. Again, that's pretty solid. Push. So I'll palpate it out for sure because we know it's a problem child. But this is all solid. So it just means one less problem. Yeah. So a little bit of break, high hip probably. Yeah. Pull across to this side. Push.
Is that good or?
No, we're good.
Okay.
Yeah. All right, cool. So.
Ooh, yeah.
I remember when I lost my mind.
It's okay.
Yeah.
I think it's okay.
I'll tape this after.
Yeah, for sure.
Too much. Yeah. So I'm basically hooking in underneath the pec. I'm rolling out to pinch it in between. Then I have my needle. I know what my intent is. And then I'm starting to thread into the tissue, but kind of towards the outside. And then it's almost like threading into like a fan kind of orientation. So even though there's one needle going in, right? We're not just creating change here. We're trying to create like a fan of change
In that area.
in that area. Good job. Okay. Tuck, bridge up. Bridge. Oh, yeah, dude. Not too bad.
Yeah, I want to feel more.
A little grumpy.
Yeah, rotating in like that. Ooh, yeah.
Right in. Pels rails is open up space and start to induce iso contraction. This is a progression.
Okay.
And then there's progressions off of that. Series of progressions we can go with flexion and IR for your shoulder.
Okay.
But the idea for you is we know there's a little bit of difference, so open up more workspace and then maybe start throwing in some lift off stuff.
Okay.
So I'll show you and then
Okay.
you can practice and I'll coach you up.
Okay.
For you, we're thinking about right side. So guess what side we're holding the stick? We're gonna drape over the ball. We're literally gonna start to work, we're setting up neutral
Okay.
spine. So orient your pelvis and your hips. We're gonna squeeze or compress into the ball. That way we can irradiate into the stick.
Okay.
So for us, flexion is a big one for you, but you can come out wider if you felt like you needed to. I'm gonna go straight arm, straight elbow.
I got you.
I'm
Okay.
gonna lock this out,
Yeah.
right? Now I can do my pels or else,
Okay.
right? It's gonna be the iso contraction, push,
Drive
pull,
it into the
push
ground.
or pull,
Yeah.
right? If I wanted to progress that into like a lift off, super easy. It'll be the same setup as this in theory, right? But I'll drop off a smidge because I got to create room to move. Does that make sense?
Yep.
I'm gonna push
And then lift.
and then I'm gonna lift.
Yep.
The shoulder, completely relaxed, straight arm. We'll walk it up just a little bit, see if we can capture some space. Nice and remote. 8, 9, 10. Relax the shoulder, completely relaxed, straight arm. 9, 10. Relax. Everything's relaxed. You're gonna know you're in theory capturing a little bit more range, and so you can
Creep it up.
You can try and creep it up, but you don't want to be at max in range because otherwise there's no room to move.
Right, for you to move.
Right.
Movement.
But you're gonna try and find it. Try and just back off just a 10.